Welcome to Southern Methodist University's Smoking Termination Enhancement Project. Here we will provide a brief overview of the program to give you more information on this quit smoking opportunity. This research study is conducted through Southern Methodist University in affiliation with the North Texas Heart Center, the University of Vermont, and the City of Dallas. The study is funded by the National Institute on Drug Abuse. The SMU Smoking Termination Enhancement Project is a research study and treatment program. The main goal is to try and improve the effectiveness of current smoking cessation treatments by adding a wellness or exercise intervention. We provide participants with cognitive behavioral therapy, nicotine replacement patches, and either a wellness or exercise intervention. Participants will be randomly assigned to one of these two interventions. The principal investigator of the study is Dr. Jasper Smits. Doctors Mark Powers and Jarita Frierson are co-investigators of the study. Our trained staff provides cognitive behavioral therapy and wellness and exercise interventions in close collaboration with the principal investigators. We feel this study is extremely important because smoking has such devastating effects on a person's health. Despite these effects, about 20% of American adults are still smoking. Smoking is the leading cause of preventable death in the United States and accounts for approximately 1 out of every 5 deaths, with smokers on average dying 13 to 14 years earlier than non-smokers. Trends show that smoking will cause more than 8 million deaths per year by the year 2030. As mentioned earlier, the goal of the study is to improve treatment for smoking cessation. Only 5% of people quitting on their own are successful, and even with standard interventions, still only 20% of people manage to succeed. Our primary goal is to increase these odds. We plan to do this by having longer interventions that provide more support for the smoker. Our exercise and wellness interventions focus on creating healthier lifestyles for smokers, hoping that this will improve the likelihood that their quit attempts will be successful. We are currently recruiting smokers between the ages of 18 and 65 who want to quit. These people must have smoked for at least a year and currently smoke at least 10 cigarettes per day. Our treatment program is quite intense and involves participation for about 3.5 months. Before officially becoming part of the study, participants must complete 2 screening visits, a diagnostic interview here at SMU, and a stress test and health screening at the North Texas Heart Center. After eligibility is determined, participants will meet 3 times a week for the first 15 weeks and receive cognitive behavioral therapy and the wellness or exercise intervention. During the second 15 weeks, participants will attend 3 follow-up visits. Throughout the study and during follow-up weeks, participants are asked to fill out online surveys about their experiences. All participants are expected to complete all portions of the treatment. Participants will receive either a wellness or exercise intervention. The wellness intervention focuses on health education and helping to maintain motivation for smoking abstinence by discussing the health benefits of adopting healthy lifestyle habits. Topics include health screenings, nutrition, diet, and sleep. After 6 weeks of cognitive behavioral therapy and the wellness program, participants will be asked to begin their quit attempt and will receive nicotine patches at no cost. The exercise intervention focuses on relieving the stress that can sometimes lead to smoking relapse. It involves exercising on a treadmill at a public health dose, with training progressing over the 15 weeks. Participants in the exercise intervention will also receive the nicotine patches at no cost at week 6, which is quit week. There are many important benefits to participating in our program. Above all, quitting smoking will tremendously benefit your health, while saving you the money spent on cigarettes. The medical assessments and stress testing provided by the North Texas Heart Center would cost over $1,500 if conducted privately. You will have access to all of these results and can share them with your doctor. The entire intervention would cost over $8,000 if conducted at a private clinic or your doctor's office, but we provide it free of charge with some monetary compensation for your time. You can receive up to $300, $175 total for assessments, which are paid in $25 increments throughout the study, and an attendance bonus of $125 for completing 90% of the treatments. If you would like to participate in our treatment study, the first step is to take our pre-screen survey at www.quitsmokingdallas.com to determine if you are eligible for the study. If you have questions or are interested in offering our program as a wellness benefit for your company, please contact Michelle Davis at 214-768-7848 or email quitsmoking@smu.edu.